What's up, future nurses? It is your favorite registered nurse slash stand-up comedian. And in this series, I'm going to show you that there is no way you will be getting NCLEX questions wrong. We're going to dive right into the video. We're talking about the biggest mistakes that nursing students make when they are studying for the NCLEX. The thing is, you are studying for the NCLEX the same way you were studying for nursing school, and that is a big problem. In nursing school, professors only want to know one thing. Do you remember information? So they're asking you things like, what is heart failure? What is diabetes? What are the signs and symptoms of pneumonia? The NCLEX is completely different because it assumes that you already know the basics. Instead, the NCLEX wants to know, can you keep your patient alive? Can you identify danger? Can you make safe decisions under pressure? When you are taking the NCLEX, I don't even want you to think that you are a nursing student. Think more of like you are a new grad nurse on a busy floor. What do you do next? The NCLEX is constantly asking questions like, who is the safest patient? Who is the least safest patient? Who is getting better? Who needs help first? Who is getting worse? When you start answering questions from a safety perspective, your scores will begin to improve. For example, let's say 4 patients are calling you. Their call lights are going off like it's going to do about 300 times in that one day. 4 patients are calling you. Patient number 1 says, "Nurse, my pain is 8 out of 10. Patient number 2 says, "Nurse, I need discharge instructions." Patient number 3 says, "I haven't eaten lunch." Patient number 4 says, "I feel like I'm having a hard time breathing." Many students get distracted by pain or emotions. The NCLEX doesn't. The NCLEX is looking for danger. Who could die first? Of course, the patient that is having a hard time breathing. Airway always moves to the front of the line. NCLEX just loves life-threatening situations because realistically, you're going to have to deal with that. Common NCLEX traps. The NCLEX will provide a list of choices that sound so good, right? It'll say things like, comfort the patient. Ooh la la, are you okay? It'll say things like, give the patient reassurance. It's going to be all right, Miss Marie. No way! It'll also say things like, allow the patient to express their feelings. Now, don't get me wrong. Those interventions are important. But baby, if somebody can't breathe, we're safe. We're not starting a therapy session. We could talk about it later. Like, Miss Marie, if your oxygen is on 70%, baby, I love your feelings, but right now we about to get you some oxygen. Hello? NCLEX test taking strategies. Every single question you read on that NCLEX, you should ask 3 questions to that question. Is there somebody dying? Is there a safety issue? Is somebody unstable? If the answer is yes, that is the choice that you should put your attention to. You would be surprised at how many questions becomes so easy when you simply focus on safety. Okay. Let's do a practice question. The nurse receives report on 4 patients. Which patient should the nurse see first? A, the patient requesting pain medication. B, the patient asking for discharge instructions. C, the patient whose oxygen saturation is at 84%. Or D, the patient asking, when will breakfast arrive? I'll let you think for a minute, but if you get it wrong, it's me and you. I know you better have said C because there's no way you worried about anything else but that airway. An oxygen saturation of 84% indicates impaired oxygenation. Remember, pain hurts. Hunger is uncomfortable. Discharge can wait, but oxygen cannot. If there is one thing I want you to remember from this lesson today, is that the NCLEX is not asking who needs attention. It is asking you who needs attention first. And whenever you're in doubt, think safety. Think airway. Think unstable. Think life threatening. And trust me, there is no way that you're going to fail that NCLEX if you know how the NCLEX thinks. Hope you enjoyed this video today. Make sure you like, comment, and subscribe, and turn on your notifications so that you don't miss a video. Baby, I'm here to help. Look at you, future nurse. It's giving RN. Hello. See you at graduation.